watching, you just confirm me whether are you audible or not. Net issue undu. Okay. Nursing part 1. Okay, so in the part 1 we have the 6 units. Okay, 6 units total. We are going to write part 1 part 2 togetherly for the 75 marks, right? Okay, so like that only, no. So first thing is that child health and nursing first part, so it is having the 6 unit. Okay, so 6 unit clears, no. So according to that, now we can see the unit wise. Okay, so once we will glance it off. Okay, so everything, introduction to modern concept of childcare. Okay, so this is the introduction unit. Okay, the first unit is introduction to modern care of child. Okay, so what are the modern care? Okay, so every nursing subject is having the things which is like, each and everything will be different. Okay, so it is going to be modernized. Okay, so that care we are going to study in this first unit. We are focusing on the history and development of the child health. Okay, so history and development of the child health, not much important that particular part, so only you should know for your knowledge purpose. From that particular part, history and development, nobody will going to be asked a questions, or if you are really expecting the questions, multiple choice questions we can expect. So the things next we can see that philosophy and modern concepts of the child care. Okay, so the philosophy, how it will be that, and the modern concept, what are the modern concepts will be there, no. So that one is very important. Okay, so now I will going to the cultural and religious consideration in the child care. Okay, so the cultural and religious consideration will be there in the child care, no. So that is also one of the important thing. Next one, national policy and legislation in relation to child health and welfare. Okay, certain laws will be there. Okay, so certain related to the children, certain laws will be there. So those laws will going to be follow nation-wise, and national programs also will be there. And we have the one second, national programs and agencies related to the welfare services and children, this UNICEF and all will be there, no, regarding that one. Okay, so study that one too. Okay, so the next one, changing trends in hospital care, preventive, promotive and curative as aspect of the child health. Okay, so the preventive, promotive and curative care only we are more focusing on. Okay, so that is the thing why I am telling in this particular unit is that, so this is all about the introduction. Okay, so the introduction will going to be tell you only the concepts. Okay, so focus more on this and the definitions, the terminologies, 2 marks questions, terminologies we are expecting. Okay, so rest it off you leave. Okay, so what are the common modern trends has been evolved means, first is a under 5-year clinic. Okay, so under 5-year clinic and baby friendly clinic has been established. You could have go and see in the Instagram also, or in the social media, the doctors used to put the clinics and all, that is very baby friendly. Have you observed that one? Okay, so if you go and visit in the hospital in the posting wise also, so you people are observed, no, so most of this toys and all will be there. Why it is? Okay, so the atmosphere should be very friendly towards the baby. Okay, should not make any uncomfortable thing, discomfort should not going to be done for the babies, okay, or the children's, otherwise they will shows lot of tantrums, okay. So in order to avoid that one, and under 5-year clinics, in order to reduce the mortality and morbidity rate of the under 5-year children's, this under 5-year clinics has been established in the community level, and those are mainly focusing on the things which is very important that you could have observed, that is going to be reduce the incidence of the morbidity and the mortality of that under 5-year children, okay. Here we are focusing on the below 5-year children's, okay. So this much only is very important, okay. So hope you understood. Then focus more on the preventive, promotive and curative care, okay. That much you'll leave. Next one is that preventive pediatrics, okay. So in that preventive, see, now olden days and all, what it is there, once disease will come, that time we will go and take the treatment, right? No, so now it is not like that, okay. Now it is the era of that we are going to be take the precautions before going to exposure to the disease condition. Suppose one example I will tell, nobody will going to be tell you that once fever will come, if you may feel that illness is like illness is having stages, multiple stages we have, right? So in the initial stage only we will adjust, okay, we will thought to going to hospital, and we will take the medications. Nowadays fever will come before light temperature will be rise, means taking dolo. Why? Because they wants to go for work, okay, they wants to do something else for tomorrow, instant treatment they want, okay. So like that kind of things are there. So that is why we are also in the child health nursing, we are focusing on the preventive, okay. So prevention is better than cure. So that is why we are doing the things which is like, you know, we are going to be introduce certain preventive concepts, okay. So before going to get the disease condition, we are administering lot of vaccination, okay, through the immunization. So that will make sure what it will be happen, you know, my dear students. So that will going to be helpful you to understand better the preventive care through prevent the disease condition through the immunization, okay. Hope you understood, okay. So this is the thing. So next one is immunization and immunization program and cold chain, okay. So this and all you are going to study in the first unit, okay. So little bit big concepts will be there. That immunization schedule, if you are not yet studied, go and study from that particular one question will be there, okay. So that is the high yield topic, don't forget to study that one, okay. So now we can go with the cold chain, okay. 2 marks cold chain they will ask. And care of under 5-year and under 5 clinics, well baby clinics, okay. So these are the things, okay. So what I have told you, know, under 5-year clinics. Under 5-year clinics, which is that you can see here, mainly we are focusing more on the people in the sense the children who are below 5 years, okay. So there we are providing the preventive care, promotive care and the curative care. And the next concept is that well baby clinics, okay. So that is also which is initiated to be taking care of the children's, okay, well-being of the babies, okay. So for that only in the community sector we have design in the like multi-specialty hospitals also, there in the pediatric department we have seen the baby friendly environment. So what is this one is that is what well baby clinics, okay. So next we will see that preventive measure towards accidents, okay. So lot of accidents will be there, okay. So it may be sudden cut, okay. So that is why toddler in the phase of toddler means 2 year 1 to 2 year age group, so there what it will be happen, my dear students, they are having a proactive, okay. So if we are putting anything downside means we near to their hand level, okay. So if they can able to take this, or suppose you think this is a knife. Okay, so they don't know this is knife, they don't know because they are not having that, like you, the mind was not yet grown, developed, right? So that is why what it will be happen, the child will take and they will cut. Okay, so these are the things will be there. Okay, so that is why certain preventive measures are there, no, that you study thoroughly, that definitely they will ask for the 2 marks. Okay, so what is write about the preventive measures towards the accidents. Okay, next one is child morbidity and mortality rates. Okay, this is also very important. So mortality, which means what, death rate. Morbidity means what, disease rate. Okay, so understood, right? So this is very important. Next thing is that difference between an adult and child, which affects on the response to illness. Okay, which affect response to illness. Then that is physiological, psychological, social, immunological, and so this is the affect response towards the illness. Okay, so that is also very important, that four things will come now: physiological, psychological, sociological, and this one is immunological, that you have to study and go for the exam. Next one is that hospital environment for sick child. Yes, I told you, no, hospital is not going to be make to, the child should not going to be get any kind of discomfort things. Okay, so that will be very friendly. Okay, baby friendly, that is what well baby clinics or under 5 year clinics we are designing, that one only. Okay, one second. Okay, next we will see mm, communication technique for children. Okay, so we can able to tell people very easily, adult people, but we have to use certain techniques for the children's. Okay, so that you study. Then here we have to focus on the grief and bereavement, that will be there in the children's more. The next one is therefore one second. The role of child health nurse in caring for the hospitalized child. Okay, so nurse will going to be responsible for very different kinds of roles. Okay, so she has to be take a responsibility. Okay, she has to be educator, she has to be teacher, she has to teach the things to the patients. Okay, not students, patients. Okay, so that is the role and responsibility of the nurse will be there, no? So that is very important. Whatever they may ask from the first unit, focus more on the things which is related to the role and responsibility of the nurse. Okay, now next we can see that principles. Okay, the principles of pre and post operative care of infants and children's. Okay, pre and post operative care of infants and children's. So most of the post operative pre operative care will be same only, but like little bit changes we will see. Yesterday I have explained in the last class. You may go and listen to that class. Okay, or else you search in the Nursing Guru channel, pre and post and intraoperative care I have explained. Okay, so that is very important. Next principles over child health nursing procedures, administration of medications, oral, IM and IV. Okay, calculations of the fluid and fluid requirement, and applications of restraints, assessment of pain in the children's. Okay, so using the different scales, numerical scales, FLACC scale and FACES, pain rating scale. Okay, so different scales we used to use, these three scale. According to these three, how we are going to be measure the pain in the children's, that is the major important topic. Okay, next we will go to the healthy child. The healthy child, second topic is the healthy child. Okay, The healthy child is, here you can see that definition and principles of growth and development. Okay, so the growth is physical, development means intellectual. Okay, hope you have the difference. Okay, so definitely they may ask for the 2 marks questions regarding the difference between the growth and development. Always remember, growth means the child can able to grow physically, and the development means the child can able to grow intellectually. Okay, so that is very important. Okay, so some MR patients or MR childs we used to see, right? What is MR? Mentally retarded. So they are not developed. Okay, so only growth will be taken place, but their brain will not going to be developed. Still they are having the brain like 2 year, 3 year, 4 year. Okay, so they used to behave in the society, right? They used to behave like that only, no, in a childish way only, but their age will be more. Okay, so hope you understand the difference between the growth and development. Growth is always the physical. Okay, so the growth is physical development, and the development, which means it is an intellectual. Keep it in your brain. Okay, so 2 marks question they will ask this one. Okay, next one we will go factors affecting the growth and development. Okay, so certain factors, like this morbidity. Okay, so this morbidity will going to be one of the reason to cause the growth reduction. Okay, so that is why, and nutrition also one of the factors which is going to be affecting on the growth reduction of the baby. Okay, next one second. Next one we have the growth and development for growth and development from birth to adolescence. This is very important. Okay, this one I can't able to explain you each and everything. Okay, so if you want means you can listen to our classes will be there, that is a paid classes, so there you can take and listen. So here you can see that the growth and development from birth to adolescence. Okay, so adolescence age till 0 to 12 years. Okay, 12 to 13 years this will come. So till that, whatever the growth and development will be there, no, you have to write. Okay, so that's cognitive development, language. Okay, there it will becomes under the language, physical development. Okay, so this anthropometric measurement. Okay, anthropometric measurement, sorry, anthropometric measurement means what? We are going to be keep on assessing the physical growth. Okay, so height, weight, head circumference, chest circumference. Okay, so that you have to start from birth to till under 5 year. Okay, so that time also we used to collect, but till 9 months and 1 year, up to 1 year we used to calculate that one. So that normal level, whether it is normal, high, like low birth weight will be there in the babies. Okay, for that and all you have to focus more. So that is the thing. So that is why each and every sector you explain it over here, because either they may ask for the 5 marks or they may ask for the 10 marks questions. Okay, don't leave any age sector. Okay, from 0, which means birth to till adolescence, don't leave anything. Okay, so if you study this one, far more sure we will get one question, either it may be for long essay or it may be for 5 marks question. Okay, so your 5 marks or 15 marks will be in your pocket. Next one is growth and development is over. So theories will be there, Fred theory, Erickson's gene, and Kohlberg. Okay, so theories will be there that you study, that is no use, means we need to use it, but examination purpose they will not ask maybe. The next one is the needs of normal children through the stages of developmental and parental guidance. Okay, so through the stages of developmental and parental guidance, certain needs will be there. Okay, so those are very important, so that you study from the second unit. And the next one is nutritional needs of the children. Okay, so especially in infants. Okay, so what are the nutritional needs will be there, no, that is very important. So in from the birth itself up to 6 months we have to uh, the baby will depends on the breastfeeding. Okay, so we are promoting the exclusive breastfeeding. Okay, so when it comes to the breastfeeding, listen, advantages of the breastfeeding techniques, position, steps, whatever the mother should follow, the education what you can able to give, the entire thing you have to study. So that is very important. Next one, baby friendly hospital concept. Okay, so sorry, before going to this baby friendly concept, one more is there, that is supplementary feeding. Okay, supplementary feeding. Okay, so supplementary feeding is that weaning, we will call it as a weaning. Okay, so once up to 6 months baby will be depends on the breast milk, right? No, so after that we used to start, after the 6th month we used to start this. You can listen here. So after the 6th month we will be start the weaning means what? Weaning means what? Supplementary food. Okay, supplementary. Okay, along with the breastfeeding we can able to give the small soft foods to the baby. Okay, so for the growth and development. Okay, so breast milk will not going to be sufficient for the growth and development for the baby after the 6th month. Okay, so along with the breast milk we will start the weaning is this, that we are using the supplementary. Okay, so as a complementary foods we used to use that banana, and as smashed banana. Okay, we used to cook the banana and we used to smash it, or else we used to use the sweet potatoes, smashed potatoes and all we used to use. Okay, so those are the things we used to give to the baby in the weaning food. Okay, so certain weaning preparation, boiling that, maintaining the cleanliness. Okay, so certain things what we need to give under the like under the period of weaning, everything will be there, that you study and write it down. Okay, so next, baby friendly hospital. So baby friendly hospital is the concept which is that which is going to be friendly towards the babies. Okay, that doesn't going to cause any kind of discomfort towards the baby for the treatment purpose. Okay, so that is the baby friendly concept. Okay, so next one is types and value of play and selection of play materials. Okay, so this play selection and materials, and as well as the value of the play, why they have to be play. Okay, so see, we used to now how the parents will think, they have to play, they have to study. They will not going to see. If you see in one Instagram reel that one children, okay, it is not a small kid, but it is that he's a up to like JE NEET kind of student. Okay, so what he have done means he is studying. His mother, when his result day, his mother is dancing and exploring her feelings towards his success, but the child can't able to do anything. Okay, so dumb, the child was dumb. Okay, so why? Because so only focusing on one thing. No, it is not like that. This play and study, all the things will be two faces of the same coin. Okay, so that is why what you should do is the sense, you have to be, while child growth and development period only, we have to encourage them to play. Okay, through the play and selection of the play and types of the play and the play materials. Okay, everything should be keep it in your mind, and that will more going to be helpful to you to get the better intellectual development in the child. Okay, so what is the value of the play? So these much you study. Okay, topic wise you study, definitely you will pass in the particular unit. Okay, so from this unit 15 to 20 marks is in your pocket. Okay, either it may be 5 marks, or it may be 2 marks questions, or it may be one mark MCQ also, because it is one of the very much important unit. Okay, next one we will go with the nursing care of neonate. Okay, so nursing care of neonate, in that particular unit, one second. Next we will see that appraisal of newborn. Okay, so the next one is nursing management of nursing management of a normal newborn, essential newborn care. Okay, so the next one, neonatal resuscitation. This is very important unit. Okay, third unit is nursing care of newborn or neonate. So neonatal resuscitation is very important. Okay, so next one is that here we have that neonatal resuscitation and as well as neonatal CPR. Okay, that pressure, each and everything you study and go and write it off. Okay, wherever using this pressure points and all, no, 1.5 to 2 pressure we used to use. Okay, so that how many compressions. Okay, so for neonate it is different compressions and like 2:15. Okay, so that will be there. Okay, so that you have to correctly study and go. Okay, so that is a very important. Next one is nursing management of low birth weight baby. Okay, so LBW. Okay, so that is also very important. What we will call LBW, no? So that is very important. Okay, so focus more on the low birth weight baby. Okay, so the next one is that kangaroo mother care. Okay, so kangaroo mother care means don't think that the kangaroo will come and give the mother care to the baby. It is not like that. The kangaroo mother care, which means low birth weight baby, they can't able to be get the sufficient warmth in the incubator also. So that is why we using the family members, mother and father. Okay, so we put the baby inside the body of the mother. Okay, so in dress only we used to put them for providing the warmth. Okay, so what is the benefit of this one? Baby will going to get the more connection towards the mother. Okay, and the family member, and which is very low cost also. Okay, so incubator charge will be going to be less only. Okay. So these are the things you should more focus. Okay, so that is this advantages of the kangaroo mother care, the procedure of the kangaroo mother care. Okay, don't think that kangaroo will come and give the care to the baby. Okay, so most of the people will think in such a way. So it is not like that. We are using the mother and the father and the family member to provide the kangaroo mother care. Okay, so same like how the kangaroo will going to be carry the baby in their pouches, same like that in human also we are including that concept. Okay, we are induced that concept and we are providing the warmth kind of care to the baby to ensure the normal body temperature of the newborn. Okay, so that is why we are using this one for in the premature babies. Okay, so hope you understood, right? Okay, this is very important while writing this one. No, focus on more on the advantages. Okay, so which is very low cost. We are using the family members in this particular kangaroo mother care, and as well as it is very low cost, low economy will be going to be spent it over here, and we are it will be build a good connection with mother and the baby, ensure that. Okay, so that kind of advantages you write. Okay, next one, nursing management of common neonatal disorders like hyperbilirubinemia and hypothermia and metabolic disorders, neonatal infections. Okay, so next one is neonatal seizures, respiratory distress syndrome, retinopathy. Okay, retinopathy of prematurity, then organization of neonatal, sorry, till here. Okay, the disease condition, neonatals, common neonatal disorders will be there, no, that you study causes, signs and symptoms, clinical manifestation. That is what signs and symptoms, diagnostic study, nursing management. You have to must and should put it off in the disease condition wherever they are asking. Okay, so this hyperbilirubinemia, this is very common in each and every newborn. Okay, so this hypothermia, everything is common. Okay, so this study and go 5 marks question from this unit. Okay, so either it may be kangaroo mother care or it may be from the disease condition. Okay, and or it may be from the neonatal resuscitation. Okay, next one we will see that organization of the neonatal care unit. Okay, so if a certain organization, while writing in the organization, you have to focus more on the things which is like, you know, how we are organizing. Okay, for example, ICU. Okay, how we are organizing the labor room. Okay, so labor room means labor OT, labor room, which will be in the same compartment. Always it will be in the downside of the hospital. Why? Because we can easily take the patients in the emergency situations. Okay, if it will be in the ground floor. Okay, so in the near to this emergency OPD, next to there only labor room will going to be. Most of the time it will be in the downside only. Okay, so that is why. Next, okay, this much is over now. Next one is organization of neonatal care unit, that you have to study, and neonatal equipment. Okay, so this incubator and all will be there, no? So phototherapy we are using that lights and all, no? So a certain different neonatal equipments will be there, that you have to list it down in one paper and just glance it off and go. Okay, so multiple choice questions I am expecting from this particular topic, and as well as the 2 marks questions. Okay, only that. Next one is that fourth unit, integrated management of neonatal and childhood illness. Okay, so IMNCI module. Okay, so this is one of the big topic. I could not able to explain in one class. I will explain you surely, don't worry about that. IMNCI will going to be, we are focusing more on the disease conditions which is occurring in the neonatal period. Okay, so for example, diarrhea and all, whatever the referral system, what is the treatment we are supposed to provide, and where we need to refer the child, and how what kind of care we need to provide according to the IMNCI module. Okay, so one module will be there. Okay, so that if you study, then for every disease condition you can put it that, and according to that you have to write it down, the signs and symptoms and all. After that, where you will refer, what kind of treatment you have given, health education, everything you are going to be follow based on the module. Okay, now that will be IMNCI finish. Okay, so diarrhea and other disease conditions will come under that. That is very important. Okay, so the next one is fifth unit, nursing management of common childhood diseases. Okay, respiratory system, certain diseases will be there, congenital disorders. Okay, so fistula, diaphragmatic hernia. Okay, the next one is other is acute nasopharyngitis, tonsillitis, bronchitis, bronchiolitis, pneumonia, asthma. Okay, so the next endocrine system means juvenile diabetes mellitus, and we have that hypothyroidism. Okay, so these two conditions will be there, that you study. Clinical manifestation, causes, pathophysiology, if it is possible, write it down, and nursing management, put a care plan, and as well as you have to write it down the health education also, put a conclusion, finish it off. Okay, so in such a way you write means it is over. Okay, so and study all the disease condition definition, 2 marks question, 1 marks, 1 question particularly it will come from this one. Okay, next one is childhood emergencies. Okay, like accidents and causes, prevention, poisoning, their causes, prevention, how we can prevent that. Foreign body, suppose some small nuts, or it may be small, what we will call that one, we are wearing, no, a small that round object will come, no, that they used to put it on the nose or ear, like that they used to do, no. So that kind of thing should not be going to be encouraged by during the children time. Okay, but even it will be possible. Why? Because it is comes under the emergency things. Okay, so childhood emergencies, so that is why we have to know the treatment modalities also to overcome from this. Sometimes what they will do, you know, in Instagram and all, you used to see, you know, they will put their head inside the bucket or this any kind of vessel. Okay, they will be stucking. Okay, so people used to open that when they're struggling, no. So that kind of things will be very common, and that those will going to be like accidents also very common, because they don't know, they will be rushed into the road. Okay, so they are not having the proper civic senses also, right? Okay, so in India we don't have adults only not have maintaining. Okay, being students, you people are not maintaining, and then how they will maintain. Okay, so that is why very important you just study this. And next one is PLS and AHA guidelines will be there, that you have to study. Okay, so that is all about the 6th unit. Okay, 6th unit is childhood, 5th is, one second, 5th is nursing management of common childhood diseases. Okay, nursing management of common childhood diseases. 6th unit is that we have the childhood emergency. Okay, this much only. Next, we will see the part 2. So here we have only one unit. Okay, in the part 2 one unit, it is all based on the systemic wise. Okay, so system wise it will be there. So in this particular system wise, okay, this cardiovascular system, whatever the disease condition will come, no, identification and nursing management of the congenital malformations. Okay, cleft palate and all, congenital malformation of the heart related to, then congenital heart diseases. Okay, so for example ASD, VSD. Okay, so that one. The next one is other rheumatic fever and rheumatic heart diseases. Next, congestive cardiac failure, this one which is related to the cardiovascular system. Hematological conditions like hemophilia, thalassemia, for sure this thalassemia is very important question, and other like anemia, leukemia, idiopathic. Okay, so this one related to hematology, blood. Okay, disease condition. Gastrointestinal, whatever the things will come now, that I told you know, cleft lip, cleft palate. Okay, congenital hypertrophic pylo pyloric pyloric stenosis. The next one is we have lot of which is related to the digestive system, no, hernia and all will be there. Malabsorption syndrome, abdominal wall defects, hernia. Okay, this and all will come. Okay, diarrhea, vomiting, protein energy malnutrition, intestinal obstruction, hepatic diseases related to liver, then intestinal parasites. Okay, so these are all very important in the gastrointestinal. Then genitourinary, which is come to kidney. Okay, so when it comes to the kidney, sorry, this is not looking like kidney. Wait. Okay, so this will. So this kidney, so related to the kidney, identification, nursing management of the congenital malformation of the kidneys, and Wilms tumor, extrophy of bladder, and hypospadiasis, epispadiasis, obstructive uropathy. Next one is nephrotic syndrome, acute glomerulonephritis, and renal failure. Okay, so which is related to the kidney. Whatever the disease condition will be same only, you have to learn according to the children. Okay, next one is nervous system. Okay, nervous system, congenital spina bifida. Okay, that is very important. 2 marks, 5 marks must and should they will ask meningitis, encephalitis. So nervous system only question will come, one question. Okay, so next one is that other disorders like club foot. Okay, club foot will be there, no, so that club palate, club lip, and club foot, 3 you have to remember. So this much only your part 1 and part 2. Okay, this much if you study means it is more than enough. Okay, so don't think that it is only one unit in the part 2, that entire disease condition you have to study, the entire MS and disease condition will be there, no, so that you have to study in one unit only. That is why it is in part 2. Okay, so this much only it is there. Then when it comes to this one, no, disease condition they ask means write it off care plan also. If it is not possible, no issues. Under 5 year clinic, baby friendly hospital, that concept and all don't forget, study and go. Okay, so only this much is very important. I have told all the things, but even though wherever I stressed, no, that topics will going to be get it off in the examination. Okay, so focus more on that and study well and write it in a good handwriting and maintain a cleanliness of the paper. This will going to ensure a good marks. So we will see you in the next class. Thank you so much for watching our live session. Thank you.